101.9 FM. Your morning of impact. Sam Marshall shares uplifting stories and conversations with people making Johannesburg and the world a better place.
It's been a jam-packed show, I tell you. It's been absolutely a jam-packed show. We've crisscrossed the country, had amazing conversations with interesting South Africans, and we continue having those conversations now. Now, today we're talking about one of South Africa's fastest growing health crises, the rise of childhood obesity, driven in part by the aggressive marketing of ultra-processed foods. Now, recent research shows that nearly half of South African adults are overweight or obese, and the number of children living with obesity has skyrocketed from 1 in 20 to 1 in 8 in just a decade. Joining me now to unpack this issue is Dr. Tamryn Frank, a researcher at the University of the Western Cape School of Public Health. Dr. Frank, good morning and thanks for joining me.
Hi, it's great to be with you. Thanks.
Dr. Frank, you've been at the forefront of studying obesity and advocating for stronger public health measures. Talk to me a little bit about that. Set the scene for us.
Yeah, well, as you've just mentioned, we certainly have a crisis of obesity in our country, and that is happening because of the proliferation of ultra-processed foods in our food supply. So if you're not familiar with the term ultra-processed, it refers to packaged products. These aren't foods that you can make at home in your kitchen. It's the types of products that when you turn them around and you read the ingredient list, it's got all sorts of strange sounding names on the ingredient list. But unfortunately, these products are also very tasty and quite affordable, and so they tend to be the things that we go to because they're quick and convenient, and so this is all the packaged snack foods, chocolates and chips and biscuits that we're consuming a lot more of than we ever used to in the past. These products weren't available 50 years ago, and now for most of us it's part of our daily diet on a daily basis. And because our food environment has changed so much and we have these ultra-processed products everywhere, we're seeing as a result increased rates in obesity, and also related to that non-communicable diseases like type 2 diabetes, heart disease, and certain cancers.
Doc, I don't know if it's a silly question, but I'm going to ask it anyway. The difference between ultra-processed and processed. So I'm now thinking processed, some of the cheese that I've seen inside the stores only have the word processed on them. And then you're saying things like chocolates, because I am still from a very old school. I mean, I don't want to give away my age, but Vili Vali was on TV when I was a child. And we've always thought of chocolate as this kind of healthy, well, we knew it was obviously sweet and stuff. And you're talking about chocolates and all that kind of stuff. And I'm a little bit worried that I, as a layman, and so do many of us that are listening to you speak, we might have no clue what is processed, what is ultra processed, because the packaging all looks the same.
Yeah, and I mean, that's certainly not a stupid question to be asking at all. So processed products are products that you can make at home and that maybe your grandmother used to make when you were a child, where things were done to preserve the shelf life. So perhaps adding a little bit of salt or sugar, boiling up beans in a pot and then putting them into a glass jar with a little bit of salt to preserve the shelf life. That would be a processed product. And cheese, like you've mentioned, is something that is processed, but not ultra processed, although you do also get ultra processed cheeses now.
Yes.
But the thing is, as you say, it's quite complicated for most people to know this. And because of that, the government has actually published draft regulations on front of pack labeling to try and make the decision easier for the consumer. So the regulations aren't yet finalized. They published a draft version 2 years ago, and it was open for public comment. We're really hoping that they are going to finalize it soon. The Deputy Minister of Health made a statement 2 months ago saying they were close to finalizing them. But what this will do is that unhealthy products that are high in sugar or saturated fat or sodium salt, or that contain non-sugar sweeteners. So these are predominantly the ultra-processed products, will carry warning labels so that when you're going to the shop, you will immediately know that it's an unhealthy product. You won't have to try and figure it out for yourself.
I'm worried, doctor, that sometimes, and as a parent, I think of, and I'll use another example of breakfasts, the cereals with those big colorful boxes, and some of them are called loops and different stuff, and and it's labeled. It's kind of, I don't know if I'm maybe not understanding it, because some of these labels or the categories they sit under things like breakfast and cereal, and breakfast and cereal in my mind by its definition means something completely different. I automatically, when I think of cereal and breakfast, I don't think of ultra processed sodium high sugary content in this, because obviously it exists under the context of the word breakfast. But breakfast for me is still tied to bananas and all these other things. And even now I've realized recently that even some of these pre-packaged bars have lots of sodium and sugar content, and they're labeled. I mean, there's very little difference between them and an actual chocolate bar other than they're labeled as breakfast.
Mm. And when you look at them, you'll see things like high in vitamins,
Yes,
or high in fiber, that make it sound like they're very healthy, right? So it's very, very confusing for the consumer. And this is done purposefully by, unfortunately, predominantly very large food corporations that work across the globe and sell products across the globe. And their main purpose is to generate a profit. They're for-profit companies. They're not companies that are particularly invested in public health outcome. And their purpose for a lot of these products that they've developed was to figure out how to make food as cheap as possible, to make as much money as possible. And one of the ways they do that is through marketing their product, advertising their products in a way that makes you want to buy it. And any mom can speak to the fact that when they're going shopping for their children, it's quite important to look at which product is the most healthy product. But if their child's in tow, their child's also looking at the images on those breakfast
Yes.
cereals. And if there's a fun cartoon character, that's the one that's going to catch the child's attention and the one that they're going to want. And unfortunately, these, health claims are used to try and make it's called a health halo effect. It makes a product sound healthy, but from research that we've done, we've found that the predominantly products that carry these health and nutrition claims are actually unhealthy products, either high in sugar or other nutrients of concern that we wouldn't want to encourage consumption of. So this certainly is quite problematic. And another great thing about this draft regulation that will hopefully come into effect soon is that any product that's going to carry a warning label will not be allowed to have any health claims on it, to try and help prevent this confusion that happens where products that are actually unhealthy are being marketed in a way that makes them appear to be healthy.
Yeah, Doc, you talked about we're talking obviously about this massive marketing machine that's driven by these multinationals and these corporates, and it actually came up as a discussion at your event calling during the Chew on This discussion, right, where you talked about the tactics that food companies use, like cartoons. In some instances, I won't mention the brand, but they give a lot of free toys in some of their products, and it does influence the parents' purchase decision when the child is pulling on your apron strings and going, "Mummy, Mummy, I want that." But the fact that 1 in 8 children now, in under a decade, is facing childhood obesity, and we now know that, for example, many medical organizations and institutions are starting to look at obesity as a chronic disease and not just a lifestyle choice. Because for the longest time, there has been this diabetes have been put on a pedestal, and obesity has been seen as this kind of you are what you eat, and yet the research and the data now shows us that obesity should be reclassified, that it in actual fact is a chronic disease. And I think that's made everybody have a different take on it, but it's also changed the nature of the conversation. Do you find that to be the case?
Absolutely, and I think that a lot of the language that is used, this speaking about it being a lifestyle choice, is because of what these big food corporations have done in terms of making the narrative fit what they want, where it'll just be, well, it's a treat, you can just have it once and then it's fine. But the reality is, the way that they're marketing it to us, it's actually not a choice for most people.
Yeah.
It's so, you walk into a store, you're seeing 3 for 2 specials, you're seeing things at a much cheaper price than the healthier products. They're convenient to eat, you don't require any preparation, and as a result, that's what gets chosen. So it's not necessarily so much about it being a lifestyle, but it's about the way that these corporations have been unregulated and allowed to market their products and build brand loyalty of very unhealthy products.
Yeah.
That really needs to change.
And is that why you've described it, Doc, now as a human rights issue?
Absolutely. It certainly is, particularly for children. The right to health is crucial, and front of pack labels are in fact a way to try and promote this by ensuring that a consumer in a store has gotten very clear, transparent information about the products that they're buying. That's very easy to understand, that can help them to make an informed choice. And also to ensure that children aren't exposed to harmful marketing on all sorts of platforms in all sorts of ways that they shouldn't be continuously, which is unfortunately the case at the moment.
We obviously know that words matter, and words carry with them a certain weight. If we reframe this as a human rights issue, what kind of gun does that bring to this fight in terms of public health advocacy? Does it carry a lot more weight, or is it just more words that we're adding to the salad?
Well, I think that the government has the responsibility to ensure that rights are protected. And so when it is a rights violation, they should act immediately to try and ensure that it can be resolved. So in that regard, it's sometimes helpful to use the rights language. Of course, we know not just in the sphere of food, but in lots of other social conditions, there are many rights that are being violated of South Africans at the moment that need to be addressed. So it does help. It doesn't solve it.
Yeah, and I think that's going to be an interesting challenge. I've now heard you mention twice, Doc, that there's these potential regulations that's on the books, right? But it's not clear when these potential new regulations or laws will be enacted. What if you could click your fingers? Obviously, it would be tomorrow. But what is a realistic timeline before you see that FOPWLs, those front of package warning labels? Have you guys, as an organization and team, have you given it an estimate?
I'm very hopeful that the government will finalize it before the end of this year. I really don't know, I think they're the ones who would have to answer that. But they do have a very solid draft regulation in place. There's also been a lot of research generated to support the regulation. So there's a really good, strong evidence base that they can use, because of course one of the concerns is how the food industry is fighting back against the regulations and not wanting them.
For sure.
But there really is solid evidence in place for the government to use to back and support the need for the regulations. And once they're implemented, it shouldn't have to take very long before the front of pack labels are on packages. The current draft includes, I think, a 6-month period to allow industry to change their packaging, but then also allows for initially stickers to be used before companies perhaps reprint their labels so that the warning labels are clearly on the packages. So it can be implemented quite quickly once it's passed.
The other thing I know, as we come to the end of this conversation, and I know you as a team have reflected on it, how do we strike a balance? And you're right, the food companies, these institutions, producers, marketers, understand obviously there's value in the pricing model, making sure that something is priced far more affordably than the healthy object. The competitive product. But in a country where we openly talk about inequality, we openly talk about food insecurity, how do you think we can win this war if we do unfortunately have disenfranchised communities, disproportionately impoverished communities where the processed or ultra processed option is unfortunately the way for them to be able to live? How do we strike that balance? If yes, of course, the packaging and the warning labels are very, very important. Putting in the regulation in place to make sure that these companies play fair, making sure that we can, to some degree, scupper the marketing machine from turning at full tilt. But it still doesn't deal with the challenges that some people just, the processed food is still going to be the option, whether there are labels and warnings, because some people are just unfortunately living below their means.
Yeah, I mean, we can't step away from the fact that more than 50% of South Africans live below the poverty line. And ultimately, the cost of food is the most important factor when it comes to purchasing foods. And so this regulation can't stand alone. It really needs to be supported by other initiatives that help to support the cost of healthy foods for our most vulnerable in the population. Things that can be done to support that would be, for instance, the revenue that is being generated from the health promotion levy, which is the tax that we have on sugary beverages.
Yes.
Could be explicitly used to perhaps subsidize the cost of healthy foods for our most vulnerable in the population, or go towards healthy foods in the school feeding program, for instance. And also learning perhaps from other countries like Colombia, who are now taxing ultra-processed foods. And if we did something like that, being able to use the revenue generated from that to subsidize the cost of healthier products. And then I think the other important thing is also to remember that these initiatives also help in the long term, where at the beginning of the conversation, you spoke about the high rates of obesity in the country, and also related to that, the diseases that go alongside it, where if we are able to try and put things in place to prevent this rapid increase of obesity and non-communicable diseases, it will help to decrease the health costs, because there's a significant health cost related to treating those diseases, and not only in terms of the health care costs, but also in terms of people losing out on being able to work because they're unwell, or having to look after a sick family member not being able to work. So it really is beneficial in the long run to be looking at ways to prevent these conditions.
Dr. Tamryn Frank, thank you very much for your time. Really appreciate it.
Pleasure. Thanks so much.
Yeah, that's Dr. Tamryn Frank, a researcher at the University of the Western Cape School of Public Health, talking to us about the growing health crisis, the rise of childhood obesity. At the beginning of the conversation, we talked about what the numbers look like now. It's absolutely skyrocketed from 1 in 20 to 1 in 8 in just a decade. That means that nearly half of South African adults are overweight or obese. And the number of children living with obesity has also grown. And in the conversation, just setting the scene for us in terms of what we're dealing with, obviously, when I talked about the discussion, there was a recent event that was held. It was a conversation where all the experts came together, and they talked about the current impact and challenges that the community is facing. And you can find out more about these conversations and the work of organizations like Healer. You can go to Healer. It's HEALA. You can find out more about the work that they are doing and how they're working with the Department of Health and trying to finalize or implement the mandatory front of package warning labels as a matter of urgency. They are doing some amazing advocacy work. You can also find out more about the work that and I want to get this correct, I don't want to make a mistake, the work that the University of the Western Cape School of Public Health is doing, and the studies and the information that they're putting out there. Okay. It's been a jam-packed show, been so incredibly busy. Thank you very much for joining us. We'll be back again tomorrow with some more amazing guests. We'll have Katie, Jared. We'll talk about an amazing initiative that's happening in South Africa to train women on how to be car safe. So if you want to find out how you can join it, it's absolutely free. We'll have that discussion tomorrow. So it's a wrap from me. Remember, be good, do good.